This conference will now be recorded.
Welcome. So now this will be the session 2 for the Obstetric SBA, and let's begin. Thank you for joining. Now, question number 1. So 35-year-old woman with sudden epigastric pain radiating to back, and she had reportedly right hypochondrial pain. She is 30 weeks pregnant. Antenatal visit, her blood pressure was normal. She is apyrexial. Tachycardia is there and hypotension is there. So what do you think? What could be the diagnosis?
Ma'am, B.
Yes. Now, why we are thinking why we are thinking hepatic rupture could be the answer. The key points are right hypochondrial pain, hypotension, and tachycardia. Okay. So because of these symptoms, it is a hepatic rupture.
Yes, ma'am.
Very nice. So ST5 doing elective cesarean section, and indication is breach. On exposing uterus, he discovers the lower segment is extremely vascular, and the scan previously shows fine. Now, what should the person do now?
Ma'am, A.
Yes, and answer is A. The person should call for competent for consultant. Now, why A is the answer? Because like because yeah, ST4, this is outside the competency of ST4, and only ST5 and above should do these kind of cesarean, or even the consultant should do. So the good idea, and they have not given anything about the fetal heart. So the moment he put a nick on the uterus, there could be possibility he would lose both mother and baby. So good idea is to wait for the consultant so that at least mother would be saved.
Yes.
Yeah. What is important is factors for the postpartum sepsis.
Ma'am, cesarean section B.
Cesarean section, how much is in the incidence? More common?
Manual removal.
Manual removal, in how many cases you will do? Very small number of cases manual removal is done.
Ma'am, then A.
See, asymptomatic bacteria happens in, as per, I remember the percentage is up to 5% of the pregnancies. So this could not be the answer. Most of the patient will be delivered by vaginally. Manual removal incidence is very small. So rupture of membrane is most common condition. Prolonged labor is not related to infection. So answer would be D, that is a premature rupture of the membranes. Now, and from your new guideline, these are the risk factor for the sepsis. Now, these are the maternal risk factor. This is the obstetric, and you can see the prolonged rupture of membrane. They have put at the number 1. Okay.
Okay.
So this is the answer. And a couple anxious of boy being born with autosomal recessive condition, and anxiety seems that relative has a baby with autosomal recessive condition. What is the most common recessive condition worldwide?
Ma'am, E.
Worldwide, it is beta thalassemia. Okay,
Okay.
so most common
Yes, ma'am.
autosomal recessive. See, now there are two things. If your question says worldwide, like, then it will be beta thalassemia. If they say Europe, then it will be cystic fibrosis. Because
Okay. Okay.
incidence of cystic fibrosis carrier gene is 1 in 25 in UK.
Okay, ma'am.
Okay, so you are counseling a patient about PGD. They have been told that the baby have autosomal recessive condition. So what are the characteristics of autosomal recessive condition?
A. Both parents.
Yes, because autosomal recessive condition, like one gene will pass from both parents. then only the disease would be manifested. So both parent to be either carrier or either affected. So now this answer will be A, that they carry abnormal gene, because the gene has to come from both parents. Okay, very good. So 27-year-old woman with a blood pressure of 110 and brisk reflexes, headache, visual disturbances. She had a kidney transplant. She was switched from ACE inhibitors to levodopa. You decided to give magnesium sulfate. She has not voided urine last 6 hours. What will be the regimen of magnesium sulfate?
Ma'am, D.
Yeah. No, see, loading dose is given full. Maintenance dose is half. Loading dose will be full only.
Yes, ma'am.
Okay. So
Yes,
now this is from the talk only. Magnesium sulfate can be used for both maternal and fetal indication in renal transplant patient. Loading dose is 4 grams is given irrespective of renal function, but maintenance infusion would be half. So loading dose is 4 and maintenance is 1 gram, so they have put it half. So answer would be D. Okay.
yes, ma'am.
Yeah. Okay, apart from this, like you're planning to induce a renal transplant recipient, induction is getting done. She is taking 10 milligram prednisolone. Her renal functions are fine. What additional precaution is given?
Ma'am, C.
Yes, very nice. Because if the patient is taking like more than 7.5 milligram of prednisolone per day, more than 2 weeks during pregnancy, in that situation, stress dose of steroid is given, and the stress dose of steroid is hydrocortisone, 50 to 100 milligrams 6 to 8 hourly. So answer is C. Very nice. Now, a 25-year-old woman kidney transplant who wishes to embark on pregnancy, her graft function has been controlled. She has proteinuria. She is on ACI for the control of hypertension. What advice you would like to give to her? So she has come for the preconception counseling, and she is taking ACI.
Yes, ma'am. A.
Yes. So ACI has to be continued till pregnancy test come positive. After that, they has to give the non-teratogenic medication, because this is the list, and antigen receptor antagonists, they are teratogenic. Because of that, once the patient get pregnant, that time we have to change to the another medication.
Yes,
30-year-old woman diagnosed with acute kidney injury. What could be the most common cause of acute kidney injury in obstetrics?
ma'am. D.
Yeah, very nice. So answer is D. Now, preeclampsia leads to acute kidney injury in 1.5 to 2% of the cases, and it is the most prevalent cause for acute kidney injury. So, again, the patient with 30 weeks pregnancy with a blood pressure 160, 150, and hello, hello,
Ma'am,
hello,
D.
yeah, yes. So answer is D. So urine output if falls below 20 ml per hour, or creatinine is more than 90 per kilomole per liter, 50 dose reduction to be done from 1 gram per hour to zero point 0.5 gram per hour. Now, type 1 diabetic, she's on insulin from 4 months prior to pregnancy, admitted for induction of labor. What should be the management when she is in active labor?
Ma'am, C.
Yes. Uh, because the patient is already on insulin pump, so insulin pump can be continued, but sometime whenever the patient is pushing or changing in the position is done, maybe sometime there could be detachment of the pump from the body. So whenever they think it is important, that time they will do monitor the this thing glucose level to see whether accurate amount of the insulin is coming or not. Okay, so here the patient is going for the vaginal birth, so induction of labor vaginal birth, so this is the answer. But if you find any other question where the patient is being taken for any surgery and the patient is on insulin pump, that time the answer would change. That if the patient is taken for any surgery and the insulin pump is attached, that time insulin pump has to be removed, because it will interfere with the energy sources, and the patient has to be put on the sliding scale insulin. But when the patient is getting vaginal birth, usually we are not using any energy devices. So answer is C. Very nice. Now the patient has ulcerative colitis refractory to the standard treatment. She has continued medication throughout pregnancy. What is the impact of medication, influmaximab, on the mother and the baby after delivery?
C.
Yes, answer is C. Now, infant who in utero given anti-TNF agent, so the infants have been given anti-TNF agent. Live vaccine should be avoided for 6 months of the pregnancy. Non-alive vaccines can be given. Apart from this, this is the this is a suggested gestation when the discontinuation of the medication is given, and for infliximab, it is in 21 to 22 weeks. They want the medication to be changed. Now the patient, 13-year-old patient suffering from IBD, she is taking sulfasalazine. So, what is the likely course of IBD in the pregnancy?
Ma'am, B.
Likely to be active, more active during pregnancy. Yet, A or B both could be the answer basically, because if the patient conceives in active phase, possibility of relapse are high. That are twofold. Okay.
Okay, ma'am.
Hmm. Now, what is the detection rate of trisomy 21 with nuchal translucency, uh, absence of nasal bone, ductus venosus Doppler, tricuspid regurgitation, and maternal serum markers? So, what would be the rate?
Ma'am, C.
Uh, okay. No, answer yes. Answer is C. So if they have added absence of nasal bone, basically in anti-scan they are saying, if this is the anti-scan features, but the nuchal scan that we see, that the nasal bone and nuchal translucency, and also tricuspid regurgitation and ductus venosus, they usually adds to the possibility of finding Down syndrome. So, detection rate is 95%, but a false positive rate is will be less than 3%. If these are not improved, then the false positive rate is 5%. Now, 29-year-old woman, first time at 12 weeks. What is the false positive? Why will be false positive rate as twice as high in the singleton pregnancies?
Ma'am, C.
Yes, because both of the twins will have same genetic makeup. Now, 30-year-old woman with hemoglobinopathy, she's having repeated blood transfusion. She wants to get pregnant. What, uh, what should be the ferritin level at which the chelation is advised?
Ma'am, C.
1,000. It is 1,000. Yes, it is 1,000 only. Answer is C. And usually it may start after 10 to 20 transfusions. Okay, so this answer is same only. So,
Yes.
so answer will be 10 to 20. Answer is D. Now, which hormone is responsible for reducing water content of stool during pregnancy? By making constipation a more common in pregnancy. So, what is a hormone?
Ma'am, A. Aldosterone.
Aldosterone. Yes. So, the aldosterone stimulates sodium and the water absorption from the renal tract and the gut. So, if the absorption of the sodium and the water is there, obviously the stool will be hard. 20-year-old woman, 8 weeks, complaining of chronic constipation. She missed her last period. She opens bowel twice a week and strains more than 25% of the time. And she has been prescribed hyperosmolar laxative. What is the untoward side effect of this laxative?
Ma'am, A.
Yes. So common side effects are of flatulence and the abdominal bloating when the hyperosmolar laxatives are given, because they contain what, indigestible sugars that ferment in the gastrointestinal tract and produce excess of gas. Okay, this is the explanation. 30-year-old woman, and she has been referred for abdominal cerclage. What is the indication for abdominal cerclage?
Ma'am, E.
Yes, because when the cerclage is getting offered, in the cerclage we have to hold the cervix with a tool, sponge holding forceps. We usually hold in the pregnancy, and that time if we can't hold cervix, then the stitch cannot be put. So answer is E. Now, 29-year-old woman with 2 miscarriages and transabdominal cerclage at 11 weeks, and posteriorly not was tied. 19 weeks, brownish discharge with appearance of pregnancy signs. She has having IUD. What will be the treatment? The patient has a stitch and the baby is dead.
Ma'am, D.
Yes. So, with a posterior colpotomy, like suture will be alternatively cut. This is the according to the guideline. If less than 18 weeks are there, then with a suture in place they can do dilatation evacuation. But if the baby becomes bigger, like more than 18 weeks, that time, or if it is difficult, that time they will cut the suture by doing posterior, by making a posterior colpotomy, and after that they would they will induce delivery or they do dilatation evacuation. If this also fails, that time consideration for even hysterotomy will be done or cesarean section. Okay, so this is the marker, 18 weeks. You see, 29-year-old woman for counseling. She has 4 miscarriages, 2 failed vaginal stitch. She has very little cervix. That means again very small cervix. What would be the approach to take care of miscarriage in this woman?
Ma'am, B.
B is what? It's abdominal.
Transabdominal circulation.
You, why you want to wait till 10 to 11 weeks? Uterus will be more big.
Okay.
So your answer is right, but A.
It's A. Okay, ma'am.
Okay, so this is from the guideline. Now, what they say that transabdominal cerclage can be performed preconceptionally, like before she gets pregnant, they can do it, or in early pregnancy. So, early pregnancy, the patient is already 6 weeks. So, waiting, if you wait for this time, uterus will be big, rotation of that tape will become difficult, and the vascularity will be more. So, good idea is to do now.
Okay, ma'am.
Now, with nuchal translucency only, what will be the detection rate of trisomy 21?
Ma'am, A.
Yeah, this is 77%. So, a 33-year-old woman for booking, she opts for integrated test. Why we are doing integrated test? Meaning of the integrated test, like we're combining the first trimester screening and the second trimester screening, and then the calculation of risk is done. So why we are doing that? Why integrated test is offered?
Ma'am, A.
Yes, very nice. So we do the integrated test because it provides more comprehensive assessment for individual, and it has got a high detection rate and low false positive rate. So it's high detection rate. Okay, it has a higher detection rate for Aneuploidy. Even B is also correct.
Okay, ma'am.
B, because higher detection rate and low false positive rate.
Okay, ma'am.
And this is another new thing, you can see that it also helps in screening new open neural tube defects, and also certain genetic condition like Smith Lemmy Opitz syndrome. This is from internet only, just so that is another learning point. Now, ultrasound is being performed at 14 weeks. There is a singleton viable pregnancy and adnexal mass. So, what ultrasound feature would help identifying whether it is a borderline, benign, or invasive?
Ma'am, E.
Yes. So, this is the ovarian crescent sign. This is ovarian crescent sign. You can see it in the picture. Ovarian crescent sign is seen in the USG. Uh, Usually, what happens when the cyst is big? So ovary become very very suppressed, very much compressed, and this kind of shape the ovary will take. So if that happens, this is basically normal ovarian tissue. It is the crescent sign. It helps full in excluding invasive cancer, and but doesn't include LMP, like lower malignant potential lesions. Okay, so in invasive cancer, what will happen? They will invade whole ovary. But here, in a benign condition, it has just pushed it to give a sign, crescent sign. A 27-year-old woman with 18 weeks of gestation, treated by her GP with a doxycycline. She's anxious. What could be the treatment risk for this treatment in the pregnancy?
Ma'am, E.
No, no. Doxycycline, you might have read in pharmacology also. Why we are not giving doxycycline to the pregnant woman?
It will cause tooth and bone discoloration, but
Yes,
ma'am,
yes.
weeks, 18 weeks gestation. And she had received it in first trimester only.
Suspected infection. Oh, so it is not associated with risk as used in first trimester. Okay. The, then this detail then I had to review, but learn
Okay.
this. The doxycycline causes a tooth and bone discoloration. But tooth and discoloration will be in which trimester, that I need to review. I would explain it.
Okay, ma'am.
Hmm. Now, what is the common adnexal cystic lesion diagnosed at 16 weeks?
E.
Yes. This is dermoid cyst or mature cystic teratogenoma. It is the most common adnexal mass that can be detected after 16 weeks of pregnancy. Like what percentage of childbearing women affected by epilepsy? Any guess can be there.
Point B. B.
Answer is I think B only. So this is uh, answer is B because this is from the internet. So 0.3 to 1% women are affected, and another correction I had to do. So this part you were very right that answer should be E here because it causes tooth staining when it is taken in the second and third trimester of pregnancy. And why it causes that? Because it causes permanent tooth discoloration and enamel hypoplasia. But that time it has to be taken in second and third trimester. This is because it binds the calcium and of the developing bone and tooth. So answer is C. You are right in that. So, what is the effect of epilepsy on the maternal mortality?
Ma'am, C.
Yes, it increases 10 times. It increases tenfold. Okay, SUDAP. Usually, SUDAP occurs.
Okay.
25-year-old woman, high doses of valproate. She unexpectedly fallen pregnant. She's 8 weeks pregnant. What is your treatment?
Ma'am, E.
Yes. Now, why it is E? See, all on patient taking antiepileptic, they should take 5 milligram folic acid prior to conception, continue till 12 weeks. So this part, this is fine, but this is there in all questions. Now another question: the patient who is taking valproate, it can affect the development of the baby. So the patient is unexpected, like it is a unplanned pregnancy. So a stopping of the valproate cannot be done by us. Okay, so all four answers are correct. Only E is correct because you will say that continue the medication and see your doctor. So answer is E because it is the neurologist who would assess her and the change in the medication will be done. We cannot do as a gynecologist.
Okay.
The patient is diabetes insipidus as 20 weeks. What is the biochemical associated with this condition?
Ma'am, A. Hypernatremia.
Yes. Why? Because what is that in diabetes insipidus? There is an increase in polyuria and excessive thirst. Due to why? Because the deficiency of vasopressin or ADH, uh, or there is a decreased response of vasopressin by the kidney. Because of that, there would be electrolyte imbalances and dehydration. Because of that, hypernatremia is the common electrolyte balance that we will see. 30-year-old woman has a cardiac arrest and she's undergoing cardiopulmonary resuscitation. when the perimortem cesarean section should be done for this woman?
Ma'am, A.
Yes, after 4 minutes. So perimortem cesarean section, usually it is performed when the uterus is approaching above the umbilicus. So in this apart from this, there is no response in first 4 minutes. So like more than 20 weeks, she should be, uterus is approaching above umbilicus. Even D could be the answer, but it is 24 weeks. So 24 weeks will be at the level of umbilicus. Usually it has to be like above umbilicus. So this answer becomes C, D, and E should not be there, because 24 weeks there is no problem. It has to be more. So here they have not mentioned the number of weeks, and so this two could be the answer. 5 is not there, and 4 minute we have to do the cesarean. So answer becomes A. So because in the exam you have to look at the all 5 options with the equal importance, uh, because in the exam you're not going to get the same questions, you will get different. So good idea is that to read why all other are not the answer.
Yes, ma'am.
So what is the ideal time of perimortem cesarean section to be in the best interest of mother?
Ma'am, C.
Yes, within the 5 minutes it should be completed. So patient has a cardiac arrest. What amount of the oxygen to be given in the cardiac arrest?
Ma'am, E.
Yes, very nice. So early oxygen supplementation, 100% flow, 10 to 15 liter per minute bag. It should be done, and bag mask would continue until the patient is intubated. Okay, so the answer is B. Now 23-year-old woman having a cardiac arrest, CPR is initiated, CS is performed. Unfortunately, patient died after 30 minutes. What will be the next step? Patient is died now.
Ma'am, B.
So you would leave everything. So if the resuscitation, uh, if resuscitation is unsuccessful, then discussion of coroner should occur before any lines and devices are removed. So you will leave everything, and coroner discussion with the coroner has to be done. 35-year woman having phenylketonuria. During pregnancy, what is the diagnosis of microcephaly? In case of phenylketonuria,
Ma'am, D.
yes. So microcephaly, usually we suspect microcephaly when there is a fall in 2 standard deviations. Okay, but definitive diagnosis can be there if it is fall in 5 or more standard deviation. So there is difference in the suspicion of microcephaly, and also there is a confirmation of microcephaly. So suspicion is less than when the HC falls 2 standards, and and the definitive diagnosis when it falls 5 standards. So 29-year-old woman, mild contraction, intact fetal membrane, speculum examination is performed, and what is the management is cost effective? What should be done? She is 24 plus 6 weeks. Os closed.
Ma'am, A.
Yeah, you have to give steroids, and also you have to consider giving protocolytics. So this is the answer. A 30-year-old woman, second pregnancy with a uterine contraction and intact fetal membrane. You think she is in a preterm labor. What should be done? I think it will be the same only. So, answer will be
D. Yes,
D.
ma'am.
Yeah. So we are giving nifedipine because nifedipine, though first line is 8:1 in UK, but still we are giving nifedipine because nifedipine can be small, like small tablet can be given any setting, but for 8:1, first is it is very costly, requires monitoring and the hospital admission and the IV infusion is required. So nifedipine becomes first. You are conducting a vaginal breech delivery, head is entrapped. So what you will do?
Ma'am, C.
Yes. So there should be incisions on 2, 6, and 10, according to your guidelines. What percentage of all live births are twin?
Ma'am, 3. C.
3%. So this is a data, and twin birth present approximately in 3.2% of all live births. This is the internet knowledge only. And what percentage of twins are delivered preterm before 37 weeks?
Ma'am, E.
Yes, if I searched this on the internet and I found that nearing 60% of the twin pregnancy will result in a preterm birth. So from this questionnaire, answer becomes E. That is near to 60. So a 28-year-old woman book for at 10 weeks. Booking ultrasound has a MCDA. MCDA. What is the test that predict risk of preterm birth? When the scan should be done?
Ma'am, A. D. D.
See, D is a serial scan.
Okay. Okay.
And we will do single scan.
Okay,
Isn't
ma'am.
it?
A.
Serial scans are done when the diagnosis is confirmed. Right now, we are just doing investigation for the prediction. So one scan would be done. Now,
Yes,
this
ma'am.
is the update from 2024 guideline. So according to the 2024 guideline, nice freedom. So this addition was done in the guideline. What they say, offer single cervical scan in between 16 to 20 weeks of pregnancy if the woman having twin and triplet. Okay, so this part, apart from this, progesterone is offered once a day at bedtime in twin and triplet if the cervical length is 25 mm or less, and it has to be continued till 34 weeks of pregnancy.
Okay, ma'am.
Okay, so this is the update. You may get question from update. Now, 29-year-old woman, 22 weeks, and cervical length is 22. What would reduce the risk of preterm birth? Hmm, answer is cut, but it is vaginal progesterone. This is
Yes,
vaginal.
ma'am.
Most common non-genital cause of sensorineural deafness.
Ma'am, A.
Yes, this is CMV. In CMV, all these are effects can happen, like ocular effects and sensorineural deafness occur in 12% of the patient. There may be hepatosplenomegaly, jaundice, purpura, pneumonitis, microcephaly. Again, you get the question microcephaly and relation to the CMV. So yeah, so these usually occur in the first trimester. Later the transmission will be high, but the severe infection is not seen. Okay, so answer is CMV. Very nice. Now, 14-year-old woman, 14-year gestation, primigravida, having 2 days in myalgia rhinitis and temperature. She has CMV. What is the rate of transmission? Primary infection, first trimester.
Ma'am, C.
C. So CMV transmission is in first and second trimester is 40%, and transmissions become 80% in third trimester. Fetal damage occur in 10%, and the recurrent rate of transmission is 1 to 2%. Now this is again CMV. They are asking for recurrent infection. So recurrent answer I have already given. It is 1 to 2%. Same answer. Okay. Now what when you summon MDT in a woman with a primary postpartum hemorrhage?
Ma'am, C.
Yes. This is a direct from your guideline. Multidisciplinary team involving senior staff should be summoned to attend theatre with a major PPH when the blood loss is more than 1000 ml and ongoing bleeding or clinical shock. Okay, so answer becomes C. Very clear, direct question. Now, you're investigating anemia, 19-year-old. So, what is the answer?
Ma'am, D.
Yeah, you really read very nicely. All questions are correct. So answer is D. So first trimester hemoglobin less than 11. Second and third trimester less than 105. And the postpartum if it is less than 10. So these are the definitions of anemia that you should remember, because they get you get answer question from here. Apart from this, in the UK, anemia screening is done at the booking, and this is also repeated at 28 weeks. If the patient is having multiple pregnancy like twin or a triplet, then 24 weeks also they are doing full blood count to detect anemia. You are performing elective cesarean section. What is the best prophylactic drug for the prevention of PPH?
Ma'am, carbetocin. C.
Yes. So, though this question is old, but the options are correct. So, this is a change in the newly recent guideline. So, active management of third stage of liver, vaginal birth. Previously, it was 10 units IM, but now these two are also added: 5 units by IV infusion and 5 units plus 500 microgram of argometrine IM immediately after birth before the cord is clamped. If the oxytocin is used, it has to be given IM or very slow over 3 to 5 minutes. And in the cesarean section, what they have recommended, uh, offer carbetocin by slow IV for prevention of PPH. Okay, so that's it. Any question? Any question?
Ma'am, will there be any EMQ session?
uh, EMQ, all 8 classes of EMQs are already loaded.
Okay, ma'am. Okay.
Yes. Okay, thanks for joining.